everyone. Welcome to my part 2 debrief on fatigue, pain, and opioids. Let's jump right in with the hot discussion of opioid use in rheumatology. So the presentation was actually titled Opioid Use in Rheumatology, Should We Be Concerned? Most of you, I'm sure, are aware of the opioid epidemic that has been going on for several years, and there's been an unfortunate amount of lives lost. The US isn't alone, as there are significant issues in Europe as well as other countries, so really it's a global problem. A study in the UK of nearly 3 million people who were newly prescribed opiate medications were actually prescribed them for musculoskeletal reasons, over 70%. And this study did exclude any reasons for cancer as being prescribed these medications. Studies here in the US and abroad suggest questionable evidence, though, of the effectiveness in musculoskeletal pain, especially chronic issues. So, research shows that in many cases, opiate methods are no more effective than non opiate methods. And another interesting point was that studies suggest that the pandemic didn't result in an increased opioid prescribing in musculoskeletal conditions. Actually, the presenter showed a slide that revealed actually prescribing these medications has decreased since 2021 for RMDs. Short-term use for acute issues versus long-term use for chronic issues. So this was discussed. It's really the long term that has the potential to cause the most harm, obviously, except in cases of cancer. The speaker talked about using AI to help identify patients who would most likely be harmed by opioid therapy. So that was really cool. And patients with RMDs tend to have a high frequency of long-term prescribed opiates. This presenter went on to explain that once they're prescribed, it's hard to get the patient off of them. And she also said it's difficult because there is a limited number of therapeutics in general for our patient population. Something I mentioned in the part 1 video of the session was that medicine hasn't done a great job of researching and really giving us effective treatments for pain, as one presenter noted. And really making an individual plan for each patient is so important, and close monitoring, of course. And sometimes opiate medications are indicated. And again, the patient needs to discuss this with their provider, and risks and benefits, things like that were discussed. So, and of course, non-opiate treatments should be included if they are being prescribed opiates. And so that was that on opiates. The last presentation in this session was titled Improving Self-Management of Pain and Fatigue in Patients with RMDs. So the overall goal for care is to increase the quality of life in our patient population. And the presenter said that most patients manage their disease 9,000 hours a year by themselves. And that was really interesting. She had this slide, and she said that they should be empowered to do so. It's important that we all take responsibility for our health and being and really become the expert for our own disease and therefore our own management. A growing number of patients have more than one disease, and with pain and fatigue being important components in many chronic diseases, especially RMDs, this is a really important aspect. This presenter spoke about how self-management is way more than just disease management. So I'll say that again because I think it's so important, how self-management is way more than disease management, more than just medical management, but really encompasses so many different aspects. And she talked about lifestyle changes, health behavior roles, social participation was a big one for her. Emotional self-management is also an important component. And really, she talked specifically about having a meaningful life despite having chronic disease. And she used the word refinding identity and a sense of purpose. And I know that definitely it's a difficult journey for those of us in this patient population, but it's so important to start thinking about. And specifically for pain and fatigue, she talked about sleep hygiene, physical activity, and really balancing your activities of the day, taking time to what she called to have relaxation phases at work, at home, or with other activities. These are really vital throughout the day. And dealing with your emotions, not letting them get bottled up to be later expressed as anxiety, frustration, depression. This really needs to be a personalized, obviously, course, a plan. Another interesting discussion was on the use of technology and the role of chronic pain and fatigue in RMDs. And there was a study that looked at virtual reality techniques for acute pain with non-gaming and gaming and other distraction elements. So like landscaping, just really relaxing scenes and things like that. And although she said this is currently used mostly for like phantom pain, so like pain after the loss of a limb, this presenter really stressed that she wants this type of interaction to be readily available for all RMDs in the future. And the idea is really to help control the pain and also focus your mind on the positive. There were no VR studies for fatigue specifically. She talked about using nature, using breathing techniques, yoga. She talked about having interactions with others, even if they have to be done virtually, how important that social aspect is. And she also discussed being able to, like, what she called pair yourself with vitality and less with fatigue. And talked about how applications, right, these apps on our mobile devices and can be really helpful in achieving this. And she cited a study titled Innovations in Self-Management, Fact Checker RMDs, which looked at the effectiveness of 32 apps that were specifically designed for RMD conditions, self-management apps with specifics on pain, fatigue, mood, being, and disease activity. And other apps promoted physical activity, coping mechanisms for pain and fatigue, and medication adherence as well. Of course, these apps aren't like readily available to us at this point, but I just wanted to mention it that there really are a lot of promising technological interventions in the works for pain and fatigue. And another interesting point, this presenter referred to something called compassionate technology. So I'll say it again, compassionate technology is one that adapts itself to the specific needs of the user and not one that the user has to keep adapting to. So that was pretty neat, again, using AI technology. So I thought that was really cool that all these things are in the works. And that is my wrap on fatigue, pain, and opioids. Thanks so much for watching. And I hope you're learning along with us with this Go With Us event. And I will see you soon. Take care.